Hello, my name is Darren Bertram. I'm the Chief Executive Officer of Infinity Hospice Care, and we operate hospices in the southwestern United States, primarily Phoenix, Las Vegas, and Reno, Nevada. Well, we've been using MUMS software since 2006. And MUMS really puts into a really nice package where you can be able to show these are the benefits that we're able to achieve, these are the outcomes that we're reaching. And we were able to utilize MUMS in our Joint Commission survey to be able to show the surveyor, this is what we're doing, this is how we're benefiting the patients. The surveyor loved it, and we had a wonderful survey. And I attribute it a lot to MUMS and helping us through that.
We were looking for a system that would geared more towards smaller hospices, and wanted to make sure that it worked for us. When we decided to go with MUMS, they helped us with guidance on what computers to purchase, what routes to go. They were there for us continuously. People here at MUMS are doing the continuous investigation and knowing what's going on and what the changes are coming on with Medicare, and stay on top of that with the new forms and keeping us going, so that's one less thing I have to worry about on with the Medicare changes.
I'm the MUMS coordinator, and basically I just train and start with PAS. We put a PAS in every office. Right now our current census is 429 average ADC company-wide. I think our first CPC program we went to electronic charting. So we are completely electronic now, and it's working very well. The statistical reports that we have to do for the states, I can pull all the data out of PAS. It's wonderful. I just think that we will grow our hospice even more with MUMS.
I've been a MUMS client with PAS since I opened the doors, using them primarily for billing. Came on with CPC 2 or 3 years ago. Leo and Mark treat me like family, very responsive to needs, and I like my voice is heard, and they're innovative in asking for ideas as far as what our needs are, and kind of listen to that and come up with new ways of taking care of it. So I think that's a good proactive approach to have to keep us on the leading edge of technology. And personally, our business has done very well in the last year, and I think MUMS is a good part of that. It helps us in getting the right people and going forward and gives us an edge on some of our competition.
MUMS has had a positive effect on our staff for basically 2 reasons. They are really committed to ensuring that as our agency grows, they keep up with the trends and everything we need. And secondly, I feel like the addition of the CPC has given our clinical staff so much more of an opportunity to really meet the needs of the patients, because things are not as complicated as they used to be with the paper trails and everything else. There are a lot of software packages out there, and all of them have issues, but we feel that the MUMS people respond to the needs of the hospice. They are totally committed to just hospice. They know the industry, and we feel again that they're going to get us into the next level, whereas the other software companies are not committed to hospice, and they really don't know what we do.
We are in a hospice business, and a lot of our users or nurses are in a different age group. Some of them might be in their early 20s, and there are some that might be in their early 50s or an older generation. And their learning curve and learning new software is not always the same as other generations. So we need something like a middle ground, like it's just easy to learn and for them to easy to adopt. It's a very easy software to use. It's very tailored to what we need to do. And that became like a big selling point for our company to decide to go with MUMS.
So I started with MUMS when I started hospice. So I really feel like that it helped me know how to do hospice, because I saw everything that needed to be documented, and so I just kind of learned about hospice right along with MUMS. So I feel like it helped me become a better nurse. We started our business not knowing anything about hospice. It was just something that our community did not have, a hospice. We just looked up and found MUMS at around the same time, and we got on board when we had 2 patients. When I talk to other hospices, they don't have electronic charting, and we tell them about MUMS, and they're like, oh wow, I wish we had that.